who recently had a carcinoid tumor excised from the rectum. So here we have some fragments of colon mucosa. And if we go down on these, there's not a whole lot to see. The surface is kind of lost in some areas, probably just due to biopsy technique, no inflammation. And then we come to areas like this, and you'll notice that right where you might expect to see ganglion cells, there are these little clusters of some sort of bland neural type cells. And there was one area, where is it? Of course you can't find it when the camera's going. Ah, here we go. Looky here. You could pass by and think this was the bottom of this crypt here, but it's actually not. That's a nest of neuroendocrine cells. And the question with these is, are these ganglion cells in between the muscle layers, or are these abnormal? Turns out they're abnormal, and one of the ways you can tell is that these are lining up somewhat linearly. They also have vacuoles, and their nuclei are darker. So ganglion cells will be more plump, they'll be more clustered as opposed to lined up, and they also almost always have a nice big bland looking nucleolus, which you don't see in these. So let's look at some stains. This is an S100 stain. You can see they're positive for S100. And here's a synaptophysin, which very nicely highlights the abnormal neuroendocrine cells. So this is minimal residual low-grade neuroendocrine tumor or a carcinoid in the rectal biopsy.